Now, October 2021 was a turning point in Kenya's war against the coronavirus pandemic. As Mashujaa Day gift, President Uhuru Kenyatta announced the easing of a number of restrictions, removing curfews, allowing churches to resume, and even opening door for bars. Now, the country too was fighting a double-edged sword, facing a rapid spread of the highly infectious Delta variant and trying to ration vaccine that we had to come by. With the country trying to mop up vaccines, Omicron then landed again. Purity Museo looks back at the country's bumpy war against the COVID-19 pandemic.
As 2021 checked in, it was a silent night devoid of fireworks, hooting and merrymaking as Kenyans welcomed the new year with renewed hope amid the COVID-19 pandemic. President Uhuru Kenyatta had in November 2020 issued tough COVID-19 containment measures that would extinguish the usual large Christmas and New Year celebrations. The president extended the national curfew to January 3rd, 2021, technically dashing hopes of many revelers who would have otherwise trooped to social joints and worship centers for merrymaking.
The nationwide curfew is extended up to the 3rd of January 2021. The curfew will now be enforced between 10 p.m. and 4 a.m. in the morning.
Although the U.S. Food and Drug Administration, FDA, had authorized Pfizer vaccine for emergency use in December 2020, followed by the Moderna vaccine, which was approved a week later, African countries were yet to benefit from the jabs until 2021, when the World Health Organization, WHO, in February, listed AstraZeneca and Oxford University's COVID-19 vaccine for emergency use, widening access to the relatively inexpensive shot in the developing world. In March, Kenya received the first batch of AstraZeneca vaccine from the Serum Institute of India. The 1.02 million doses of the AstraZeneca Oxford COVID-19 vaccine arrived at Jomo Kenyatta International Airport, Nairobi, on March 3rd, 2021, as part of the COVAX facility.
We've been fighting COVID-19, we've been fighting this virus, but we have been fighting it with rubber bullets. But this time round, what we have received here is equivalent, metaphorically speaking, to acquisition of machine guns, bazookas, and tanks.
Kenya's Acting Director General of Health, Dr. Patrick Amoth, kicked off the country's COVID-19 vaccination effort by rolling up his sleeve and becoming the first person to be inoculated. To date, over 3.7 million Kenyans are fully vaccinated, while close to 9.2 million others are partially vaccinated. The vaccination exercise was first targeted at those above 58 years and public servants offering critical services like security and teachers. The decision was to allow such officers to serve Kenyans uninterrupted. Vaccination against COVID-19 seems to have worked in easing infection rate, forcing the president on October 20th during this year's Mashujaa Day celebrations to lift a nationwide curfew that had been in place since March 2020.
I hereby order and direct that the nationwide dusk to dawn curfew that has been in effect from the 27th of March 2020 be and is hereby vacated with immediate effect.
Now hospitals are experiencing yet another peak, overwhelmed with mostly unvaccinated patients. A new variant identified as Omicron has been blamed for the current surge.
We have a lot of other samples that we are sequencing. So in the next 2 days, I will be able to confirm the spread or otherwise of the Omicron variant in the country.
The Omicron variant has deepened concerns about how much longer the coronavirus pandemic will last. To keep the economy going and avoid any further lockdowns, the government has already issued a red alert that in-person services will not be offered to those who have not taken the jab. This all as the government went all out to ensure that the curve almost coming down with a positivity rate below 1%. Things are again changing, and as of the 24th of December, the country was recording an upsurge in infection with positivity rate jumping to 32.6%.